Hello, everybody. Welcome back to Medet 360. I hope you all are doing well. I'm back again with another important lecture in the diabetes series, that is, what is prediabetes and what is the significance of prediabetes. It is sometimes confusing for the people, so I will try to make it as simple as possible so that everybody could understand this important concept. And if you are new to the channel, kindly subscribe and turn on the notification button so you don't miss any new videos in the series. I really do appreciate your support. Thank you so much. So now let's begin. Prediabetes is a condition that is precursor to overt diabetes. 11% of people with prediabetes will develop diabetes each year. This 11% is a very large number. To put it in the perspective, there are about 84 million people with prediabetes in the United States in 2020. So just imagine how many people are going to develop diabetes each year. So let's define it comprehensively. It is a condition of increased risk of future development of type 2 diabetes mellitus as a result of either impaired fasting glucose or impaired glucose tolerance. People with prediabetes are an intermediate group of people who have blood glucose levels that are higher than the defined normal levels, but they are not high enough to meet the diagnostic criteria of diabetes. So, pre-diabetics are individuals who are between normal healthy people and those who are diabetic. According to the American Diabetes Association Standards of Medical Care, prediabetes is diagnosed by three things. Number one, fasting plasma glucose. Number two, 2-hour plasma glucose after an oral glucose tolerance test. And lastly, by HbA1c, glycosylated hemoglobin. Now let's talk about the values of all these three tests in a normal person, in prediabetes, and in diagnosing type 2 diabetes mellitus. These values are very important and they often come up in board exams. So these values need to be memorized by heart. That's why I will encourage all of you to revise these values daily multiple times so that you can learn them by heart. The HbA1c levels in a normal healthy individual is less than 5.7%. For prediabetes, it is 5.7 to 6.4%, and in patients with type 2 diabetes mellitus, it is 6.5% or more. The values of fasting plasma glucose in a normal person is less than 100 milligrams per dl. In prediabetes, it is 100 to 125 milligrams per dl. And in patients with type 2 diabetes mellitus, it is 126 milligram per dl or more. And the values for 2-hour plasma glucose after a 75 grams glucose load, that is oral glucose tolerance test, the values in a normal healthy individuals is less than 140 milligram per dl. For prediabetes, it is 140 to 199 milligram per dl. And for patients with type 2 diabetes mellitus, it is 200 milligram per dl or more. After defining prediabetes, now let's talk about the significance of detecting prediabetes. Why it is so crucial to detect people with prediabetes. Is there any way for people with prediabetes to be prevented from developing type 2 diabetes mellitus? Or maybe just delay the progression to type 2 diabetes mellitus? If you want to know, stay with me and let's find out. Now let's discuss why prevention of type 2 diabetes mellitus is important. Development of type 2 diabetes mellitus is a slow and a progressive process. It has been estimated that the decline in the beta cell function begins at least 10 years before the diagnosis of diabetes. This leads to prolonged hyperglycemia and a higher risk of developing costly complications. Once developed, diabetes results in the development of microvascular and macrovascular complications. The microvascular complications include nephropathy, retinopathy, and neuropathy. And the macrovascular complications include ischemic heart disease, stroke, peripheral arterial disease, gangrene, which can lead to amputations, and all of these major complications. Once these complications develop, they require complex medical care and costly treatment, which is a great burden on the health services. That's why implementing strategies to prevent the progression of prediabetes to diabetes is very, very, very important. It will lead to decrease in the cost, decrease burden on the health system, and the most importantly, it will lead to reduce microvascular and macrovascular complication of diabetes. Now let's conclude this topic by talking a little about the strategies for preventing type 2 diabetes mellitus. Although currently there are no strategies that are 100% effective in preventing type 2 diabetes mellitus, however, focused interventions have delayed or reduced the prevalence of microvascular complications. And these focus interventions include dietary modifications, activity modifications like being active and performing at least 150 minutes of aerobic activity per week, and with some medications like metformin. These evidence based strategies to prevent diabetes, such as the intensive lifestyle modifications with weight loss, these are also very cost effective compared with treating the complications that are associated with the long standing type 2 diabetes mellitus. So, this concludes our lecture for today. I hope that you guys enjoyed and learned something new. Don't forget to like, subscribe, and turn on the notification button. I will soon be back with another video. Till then, take care and goodbye.